Thanks, Jamie. So now I know the secret word after lunch, warigala. We're focusing on this afternoon innovation, and we're going to give you a chance to hear about people's individual groups' individual experiences of innovation, innovative projects in our World Cafe, and I'll explain more about that shortly. But to kind of set the scene, we've got Nuno Goncalves, who has a lot of experience in the health sector with information technology, technological development, both here in Victoria and in Queensland. Please welcome Nuno.
Thanks, Norman. Good afternoon, everyone. Now, can you all hear me? Geez, those lights are bright. Yes? No? Yes? I hear yes. Okay, thank you. Good news, real good news. You're about 3 hours away from the weekend. The bad news is in the next 10 minutes you have to deal with me. So I'll try to make this as painless as possible. So we're changing the pace a little bit, and we're going to talk a little bit about innovation, and specifically around technology and how technology is enabling innovation within healthcare. One of the things that sort of keeps coming up over and over again is, what is actually innovation? Because the answer you actually get back is different based on who you actually ask. The answer I'll get from my 5-year-old daughter is going to be very different from what I consider to be innovation today. I consider an iPad innovative. She sees an iPad as an extension of the TV if I have to watch Netflix. Right? She is born into that. So here's some of the definitions of what the interweb has described what innovation is. The creation of a desired future. So SpaceX, Elon Musk, and the wonderful technologies that is bringing and continues to push upon us, the Teslas of the world, and some of you might know him in his early works as the owner of PayPal, which I'm sure all of you have used at some point or other when we're shopping on eBay. He's created a vision, or he's created a desired future in his mind in terms of the population of space and Mars, and he's gone down this vision of creating a reusable space shuttle that can be taken up to space, take people to Mars, and then be reused and landed again. Now, I put there the Jetsons because when I was actually creating this presentation, I realised I was extremely disappointed because when I was little, Jetsons used to be one of my, surprise, surprise, favourite cartoons. And I realised none of it has actually been realised. But then I did a little bit more digging, and actually there's a lot of it that's become realised and has become technology today. Smartwatches, flat screen TVs, meals out of a microwave, and surprisingly enough, the dog treadmill was actually on one of the cartoons. Anyway, so the improvement what is, or defining what could be. And we've got the autonomous car, and the use of autonomous cars are becoming more and more prevalent within our social media, in the news, and in technology that's being developed and tested overseas. And certainly the picture there on the right of the Google car, the first prototype car, is the first to be developed on what's called an autonomous level 5, which is no steering wheel, no pedals, just a button. Tell it where you want to go and it will drive you there. Amazing times ahead of us. Innovation is more than invention. It is transformation. Now, cast your time or your mind back to 2007. I know, it doesn't seem that far ago. The world release of the iPhone. Yes, it was 2007. How many of us have a smartphone today? It has absolutely changed the way we live today. It has absolutely changed the way the commercial world, the way that we interact amongst ourselves, and within the healthcare, the way that we actually interact with our consumers. It's been absolutely revolutionary. Some of you might actually still recognise, I know I do, the big brick in the middle. It was fantastic when it first came out. What? I can call someone on the move. It's great. But for those of you who constantly reverse and say the good old times, I have good news for you. You can actually buy that. So there's still hope for us as well. So innovation is creating and delivering a new customer value. And what has Uber done to the transport industry? But not that. They've done it with an app. They didn't have to go and create taxis and build these massive companies to have a customer service charter, and they did it with the development of an app that basically people went, I'll download that. Oh, look at that. I can go from place A and place B to point B, and some stranger will pick me up and take me there. Mm. It's the perceived value. It's the customer value that derives the actual attention. So now that we have a bit of a concept of what innovation is, let's have a look at healthcare. What is in the present innovation? And I know this microphone keeps carving out, so my apologies. So we have electronic medical records, we have personally controlled medical records, we have data mining, predictive models, simulators, telemedicine, healthcare in the home. This is all stuff that should be relatively familiar to all of us in the room. What we might not necessarily be across of is some of the stuff that's actually occurring today. Things like the Da Vinci surgical robot that allows an actual specialist surgeon to be able to undertake surgery via the wonders of the interweb across the world to a patient sitting somewhere else. That's fantastic. Clinical command centres. So the concept of actually centralising critical care monitoring across multiple hospitals, intensive care units, and actually, while the patient is actually connected to biometric monitoring equipment, it actually goes to a central clinical command centre, and they are fully staffed 24/7 to be able to respond as things actually deviate. So none of these beeps going off in the wards or in a patient's room and then responding 5 minutes, 2 minutes, 1 minute, whatever. It is done instantaneous. It's got an escalation point. People have a responsibility. It gets escalated and paged directly to the treating physician in the ward at that particular location. And then the other thing is mobile theatres. That's actually an example of one. Actually taking the operating theatre to the consumer. Fully staffed, fully kitted out. This exists today. This is innovation today, which is quite exciting. So now there's really, really exciting stuff. So the future of innovation in healthcare. We have implants coming along. More and more we will start seeing individual devices implanted directly into us for the purpose of monitoring or continuous treatment of chronic disease or even health conditions in general. And feeding that into the interweb, as I keep calling it, for the purpose of decision making and the general practice or healthcare to be able to actually step in and be able to provide informed decisions about my care in general. Internet of Things. And yes, your fridge is starting to get connected to the internet. We see that graph there, and based on the previous topic, more and more items are actually becoming more internet connected. So, I'm going to say there, 1992, we had about 1 million devices that were internet connected. And then all of a sudden, just after the year 2000, so around up to 2004, we have the explosion of the Internet of Things. So the definition of Internet of Things is basically a device that is internet connected. The projection by 2020 is that there will be about 50 billion devices connected to the internet, all generating data. Including with that will be the concept of smart cities. We're starting to see them more and more integrated, not so much within our society, but certainly overseas. I had the privilege of visiting Singapore, and their response to visiting an actual control centre and actually seeing the simulation of a cyclist being knocked over in traffic. Now, the computer, taking notice that the traffic had stopped flowing in respect of the actual flow of the traffic lights, had noticed that there's an irregular pattern of traffic, had notified automatically the traffic management system. He also noticed that there was a pattern on the street, on the road, in the middle of the crossway, where the cyclist had been nudged by the car, that was irregular to what was actually expected within the field of the CCTV, and had notified the emergency services response team. So the ambulances was being responded, as long as police, in order to actually redirect traffic. Meanwhile, the attendants of the paramedics actually attending the scene, through face recognition, were able to identify instantaneously who the patient was or the cyclist. That recorded back to the patient record, so the centralised medical record, which automatically notified the next of kin. All this happened in a time of 7 minutes, even before anyone who's monitoring a CCTV camera would have been able to pick up, out of 25 cameras, that something had actually occurred. So that's just an example of smart cities and integrated smart cities. Nanorobots. So some really smart people at some point basically went, well, this old genetic research doesn't really float my boat. What I reckon I'll do is I'll start developing really tiny robots that can actually be programmed to target what I want them to do. So cancer cells, tumours, I don't know, blockages in your heart, that sort of thing. And they're actually working on it right now. And the most controversial probably of them all, which is starting to get a little bit more ground and which Deb sort of touched on a little bit before, artificial intelligence and the use of artificial intelligence in healthcare to support decision making and to actually identify clinical pathways for patients with certain clinical conditions. There is artificial intelligence being at the moment trialled both in the US and in Scotland for the use of or identifying and assisting the diagnosis of cancers and within the oncology field, and facilitating the decision making on what actual treatment path in which to place certain patients with certain cancer conditions. Now, artificial intelligence is actually going to be key for us in healthcare, and the reason for that is the rate at which information is actually being produced as we stand today within healthcare is that knowledge regarding to actual healthcare is doubling every 73 days. What that means is information being generated is roughly around about 800,000 articles per year, every year, published in journals. It is going to be literally impossible for the healthcare community to actually remain on top of that going forward. The explosion of information and the information points that are actually generating that information about me, about you, about the community in the healthcare domain is absolutely astronomical. And the way in which we can actually tap into that information is through the use of artificial intelligence. Others like to call it augmented intelligence. So, what does 10 years actually mean? Or what does healthcare actually look like in 10 years' time? Now, I'm really squinting because these lights are really bright, so my apologies. I'm going to read you through a bit of a scenario, a bit of a simulation, or a hypothetical, as they call it, of a hospital trip in 10 years' time, and what it actually is to visit a hospital in 10 years' time, hypothetically. So, meet George. George is visiting his hometown to accompany his father, Martin, who's a heart patient, and Martin is being admitted for a 3D printed mitral valve replacement at Metropolis Hospital. George is surprised that the facility looks nothing like it did when he had his appendix removed at his youth. A digital console nicknamed Welcome Packet is awaiting for Martin at the entrance. It directs him to his room and helps him orient through the hospital and his schedule, and Martin's admission was automatically processed prior to his arrival. Meanwhile, they continue to make their way through the hospital into their room. George notices that the hospital's smart ergonomic layout, bright lighting, noise-free rooms, with artificial intelligence built into his health record. Martin, using his phone or his in-room touchscreen, can access information on anything related to his care, such as the risks, the benefits of the 3D printed surgery and in his condition in general. A wristwatch provided upon Martin's arrival remotely monitors his vital signs, analyses them and alerts caregivers to any significant pattern changes. George notices that the absence of nurse stations and watches robots deliver supplies and medicines to patients' rooms. So through the process, his father's hospital records are automatically populated through digital uploads, voice-captured sensors and information from caregivers. Discharge and post-discharge care are planned in advance and using predictive analytics based on Martin's medical history, how well he's responding to his initial treatment and his potential health-related social factors. During the pre-op visit with the surgeon, Dr. Mace George and Martin are able to visualise the procedure in 3D. The essential elements of the discussion are explained and extracted by a listening device in Dr. Mace's wristwatch and enter into Martin's hospital record automatically, which includes the time and date of Martin's consent for the operation. So that is a bit of a glimpse in terms of what is the hypothetical for healthcare in general in 10 years' time. In my personal opinion, that's a Deloitte's hypothetical, by the way, so I had a little disclosure on there. In my opinion, a lot of that capability is actually available today and could actually be achieved today, not in 10 years' time. So I think that's actually quite short-sighted. But anyway, that gives you a bit of a flavour in terms of innovation in healthcare in general, innovation as a whole, and a little bit of insight into my quirky little mind. So in that, I'll pass it on to Norman to introduce you to the next stage of the presentation or the workshops. Thank you.
Thanks, Nuno. Okay, so here's how it works. On your table, you've got this, which is a map of the locations. So there are 3 in here. 1, 2, 3 locations in here. There are 2 out there, and there are 3 more in room number 203. You've got what they are, and you can choose 4. Is that right? Choose any 4 that you like. And you've got 10 minutes at that table to hear the presentation and talk to the presenter about what they've done, how they've achieved it, how they've got there, what the learnings are, whether you can take away and spread it, or whatever you want to do. And at the end of 10 minutes, you will be moved on unceremoniously to your next choice, and so on. So it's a chance for you to get a real, a serious look at the projects that have been going on, and the ones that you actually will benefit from the most. So have a think about it. What do you want to go to? Make a choice. You've got 4. And Julie, we're resetting now. When does this start? It starts now. There's nobody sitting there. Is there somebody sitting there? Oh, somebody's sitting there. Okay. So it starts now. Go to the station that you want to start off at.